For this video, I'm going to do humidity with trach cares. So obviously before you do anything, you want to check patient's charts, see there's physician orders. You'll want to wash your hands, gather equipment. In this case, we'll get a bubbler with the correct tubing, a trach mask, and then a suction kit and a trach care kit. So when you walk in, you want to wash your hands, wear the correct PPE, come in, introduce yourself, let them know what you're doing, verify it's the correct patient. You want to assess the patient, vital signs, SpO2, breath sounds. You want to make sure the patient is in a comfortable position. When you walk in, you want to verify the airway and the size. Make sure you have the correct size. So this is a sterile procedure, so you'll want to wash your hands, wear sterile gloves. So to start, we'll have our sterile gloves on. We'll suction the patient first. So you'll have this continuous suction. We'll suction the patient. Once you hear resistance, then you can pull out slowly in a twisted motion. Once you're done with that, you can clean it and do it again or dispose of this. Once you're done with suction, you have your tray here ready. You'll have peroxide on one side and sterile water in the other. You'll start by taking off the old dressing. And then we'll dispose of this. We'll take out the inner cannula. If it's disposable, then you'll just toss it and put a new one in. If it's not disposable and you have an extra one, then you can place it back in there. And then you'll want to clean the other one. We'll clean it with peroxide, and then you can use a little scrubby, and then we'll rinse it with sterile water. Once you're done with that, we'll clean the stoma with sterile Q-tips. We'll do one on one side and the other side until you hit all four sides. And then we'll clean the outer tube. Once you're done with that, you'll want to replace with pre-cut sterile 4x4s. And then if you need to exchange the commercial hold tubing, then you'll do so now.
Hello.
Hello.
From IT.
So yeah, once you verify it's on correctly and the person's oxygenating and ventilating correctly, then we'll set up our humidity here. So we'll use just a regular bubbler. We'll have this cap off, and then we'll make sure it's on there secure. We'll connect this to the oxygen. And we'll use the correct tubing, turn it up to 4 liters, and then test it for the pop-up valve. And then you'll hear that whistling sound, so you know it's on correctly. You'll make sure you adjust the correct FiO2. You'll place this on the patient. Make sure that they're saturating right. Once you're done with that, you'll make sure the patient is comfortable, everything's within reach, and then you'll make sure you discard. You grab all your stuff that you brought in, throw it away, take your gloves off, wash your hands, and then let any personnel chart, and then let any personnel know.